Good evening and thank you for joining us. A public memorial continues to grow for a 10-year-old boy who died in a collision with a school bus yesterday. The devastating incident occurred at the corner of Red River Road and Clarkson Street while the boy was riding his bicycle to school. Classmates and members of the public have been coming to the intersection to drop off flowers, stuffed animals, and artwork in memory of him. Thunder Bay Police continue to investigate the circumstances around what happened. Officials with Lakehead Public Schools confirmed yesterday that the boy was a student at one of its schools. The consortium that manages school buses in Thunder Bay has also posted condolences on social media to the boy's family, along with the bus driver, first responders, and the students who were on the bus when the tragic collision occurred. A Westford ward meeting got a bit heated last night as concerned residents discussed the terrifying shootout earlier this month in the parking lot of the Spence Court apartment complex. A panel of city officials, including Westford Councillor Kristen, Mayor Ken Boschkoff, and new police chief Darcy Fleury fielded questions from a frustrated public. The May 2nd incident was a shock to the neighborhood as 4 people traded gunfire in broad daylight. Fortunately, no one was hit with any of the bullets. Last night, many residents demanded more enforcement from police and pointed to the need for a comprehensive strategy. The city officials reminded the crowd that many of the issues at hand largely fall out of the municipal scope and require action from the province. Fleury was quick to point out as well that these issues are prevalent in other cities across the country and are by no means unique to Thunder Bay.
I was hoping that that we would get some really good information and feedback from the community. I think we did to some level, but I think it was also an opportunity for the community to voice their concerns and to share their frustration and their fear and their anger, quite frankly, and I'm right there with them.
Well, it's unfortunate, but this problem is across the country. So I've said it a few times now to some of the people that I've been having conversations with, meetings with, is that what we're seeing here is not really unusual across the country. We're seeing it in many of our cities, big and small, and it's a problem that we just really, as a society, have to take on some of the more social pieces and mental health, addictions, that type of thing.
Fleury will now host the first of 2 town hall meetings on city policing, starting at 6:30 this evening at the Oliver Road Community Centre. City police are reaching out to the public to identify more potential victims in a sexual assault investigation that dates back to last August. Police say a city resident allegedly used social media to meet a youth online, supplied the youth with alcohol, and then sexually assaulted them. 20-year-old Christian Lynn Himes was arrested in February for sexual assault, invitation to sexual touching, and luring a person under 18. Further investigation has now led to child pornography charges against Himes. Investigators are asking anyone who suspects they may have been targeted by the accused to check their social media accounts and contact city police. Canada's health minister was in Thunder Bay today for a major funding announcement to help limit the spread of blood-borne and infectious diseases in the north. Jean-Yves Duclos was at Elevate NWO to provide millions of dollars to a program called Strengthening Peer Engagement for Northern Ontario. Elevate is getting $2.6 million of that money. Carl Langdon reports.
No one government, and certainly not the federal government, and no single organization can reduce the health impact of sexually transmitted and blood-borne infections alone.
That spread of sexually transmitted and blood-borne illnesses has seen a notable rise in Northern Ontario, with a significant portion of new infections coming as a result of a lack of access to safe supplies for illicit drug users, who, when faced with challenges obtaining supplies, may fall back on decisions that ultimately put them at greater risk. It's for this reason that social issues relating to the spread of infectious disease are so heavily linked to the use of illicit drugs.
People who are living with or at risk of HIV, Hep C, overdose, or other harms prefer to get their information from peers and from family. Our project seeks to put that education and that information into the hands of people who have lived experience.
Gonvay says a network of trusted peer support workers often makes the difference between an individual seeking support or not, and provides opportunities for service organizations to extend warnings, as well as information on safer practices to drug dealers that they normally would have no way of contacting.
could well imagine that most drug dealers are not going to let me into their apartment if I go knocking on their door, right? One of our peers was very active in their substance use, and they were able to talk to some local drug dealers who didn't know that they needed to wipe down scales or change gloves.
The issues at hand are complex and require a deep knowledge of individual experiences, many of which are almost impossible to obtain without being in a state of active substance use, which is exactly why the help of peer support workers is so essential. Carl Langdon, TBT News.
Thunder Bay Regional Health Sciences Center has announced that it's scaling back its masking rules and lifting some other remaining COVID-19 protocols for visitors and staff. Masks have been mandatory in all areas of the hospital since the early days of the pandemic in 2020. But in a media release, hospital officials say patients and care partners will no longer be required to wear masks when entering the hospital unless they're symptomatic or for specific situations that require it. Masking will also no longer be required in public areas like the cafeteria or Robin's Donuts. Staff and volunteers will still have to wear a mask when providing direct patient care. The hospital will continue to provide masks at the entrance for those who want them, and visitors will still have to sanitize their hands and self-screen for symptoms. There's more friction between the Premier and the Mayor of Mississauga. In his first public appearance since Bonnie Crombie said she's preparing a run to lead the provincial Liberals, Doug Ford wasted no time targeting his potential opponent. Alison Hurst has the details.
Premier Doug Ford didn't miss a chance to take aim at Bonnie Crombie's potential run for Liberal leadership.
Bring it on.
It comes after the longtime Mississauga mayor's long weekend announcement she's formed an exploratory committee, and at a critical time for the city, which is working to split from Peel Region by 2025.
We're making the largest change in the history of Mississauga and Peel, and this is all about Bonnie Crombie's political agenda. In my opinion, it's a real slap in the face to the residents there.
Crombie says she won't be stepping down as mayor, but instead will dedicate personal time to the campaign.
Well, she's got his attention as far as he's concerned. Her announcement yesterday is the beginning of the next election campaign, and he's into it.
In a statement today, the Mississauga mayor says in part, "Let me be clear to Premier Ford. My record as mayor speaks for itself. Day after day, I put the people of Mississauga first." Adding, "I will make a final decision about my role in leading the Ontario Liberals once I hear from the diverse voices across the province."
There is a leveling off.
Crombie is just the latest name added to the list of those potentially running for Liberal leadership, but political analysts say she's the front runner.
The more he showers attention on Bonnie Crombie, the more it makes all the other would-be contenders for the Ontario Liberal leadership look very small in comparison.
After the Premier's comments this morning, NDP leader Marit Stiles took aim at the province's cuts to health and childcare, adding that while the Liberals are busy trying to figure out who they are and where they stand, New Democrats and our team of 30 MPPs are working to win more for people.
It also sends a message that he's actually, in his heart of hearts, more concerned about the Liberal Party's potential to renew itself than he is about the New Democrats' potential to take over government.
Liberal leadership candidates have until September 5th to register, and a new leader will be announced December 2nd. Alison Hurst, CTV News.
A 29-year-old woman from Gull Bay has been charged with careless driving following a four-vehicle crash near Loon Lake yesterday evening that completely shut down a section of Highway 1117. It happened sometime before 5 o'clock and involved two pickup trucks and two SUVs. Fortunately, there were no serious injuries, and the highway was reopened to traffic a little after 6 p.m. yesterday. Some River Street residents are raising concern after the work on the collapsed culvert apparently caused sewage to flood their basements. City officials say they became aware of sewage backups at 4 homes about a month and a half ago. Pumps have been set up to pull sanitary flow away from the problem area and across the new bridge. The most recent overflow happened yesterday and took crews 15 minutes to even out the water levels. A neighbor we spoke to on scene who didn't want to be identified said her basement has flooded with sewage 4 times since the issue began. While there's no timeline for a fix, city project engineer Mike Vogrig says crews are working hard to find a solution.
So right now what we've been doing is I've got some calls back into sewer and water to talk about where these flows are coming from, and we're looking on site at basically upsizing these pumps. It's hard though, it's shooting in the dark because we don't know what kind of flow we have to design for, so we're trying to figure out a solution so this doesn't happen again.
Vogrig says affected homeowners have been told they can put claims in with the city. The final paving and sidewalk construction on a portion of High Street should be done by early next week, according to city officials. The majority of the work between Oliver Road and Queen Street was completed late last fall, just as winter weather arrived. City project engineer Brian Newman says crews came back last week to repair some small sinkholes under the first layer of asphalt and complete concrete repairs and finish up the sidewalks. The project was supposed to be done last year, but the contractor experienced some delays.
Well, it's the start of the season, so far so good. It's early on. There will be delays as we all experience the construction. High Street was a late project last year, so the contractor hustled to get where they did get to. The few things that did go wrong, they're cleaned up now. Hopefully, the painting gets done, like we said, in a timely fashion, so we can get the bike safely running down High Street and the general public using it as well.
Newman says the final layer of asphalt should be laid by the end of this week, followed by line painting and bike lane painting early next week, at which point High Street will be fully reopened. Confederation College hosted its annual President's Breakfast this morning, where Kathleen Lynch outlined the college's report to the community for 2022-23. The report highlights the milestones accomplished through its strategic plan.
We're pleased to be able to provide an update on the third year of this plan.
According to Lynch's report, over $700 million was added to the regional economy by the college and its students last year. The college also achieved a graduate satisfaction rating above 83% and a graduate employment rate above 91%. The breakfast was attended by local MPPs and other community representatives who support the college. Lynch says she's satisfied with the outcomes of the strategic plan, and she expects the college to continue playing a key role in addressing the region's workforce shortage.
We want to definitely improve our trades education and training, being able to offer more opportunities and get more students interested in that. We also want to meet the needs of our healthcare organizations. There's lots of shortages. We hear about shortages in all kinds of areas. So we're going to hopefully launch a couple of new programs in the next year or so to meet that need.
To come back and this year and have full student participation, everybody back on campus, and then record-setting numbers for a school for summer intake, it's just exciting to see.
Lynch is also proud of the college's growing diversity. More than 50% of the student body is represented by Indigenous or international students.